Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Scleromalacia perforans. Scleromalacia perforans. Scleromalacia perforans is an anterior necrotizing scleritis without inflammation. Here there is scleritis which is associated. See, there are three things. One, scleritis is inflammation of sclera. There is necrotizing is seen, that is necrosis is seen, and it is mainly anterior, but there is no inflammation. There is anterior necrotizing scleritis without inflammation is Scleromalacia perforans. In Scleromalacia perforans, most commonly occurs in women. Actually, scleritis is a generalized term for inflammation of sclera. But here in Scleromalacia perforans, there is no inflammation. It is most commonly seen in women, and it is also associated with long-standing seropositive rheumatoid arthritis. Spontaneous perforation can occur, though it is rare, but it can occur in these patients. But if intraocular pressure is elevated in these patients, then spontaneous perforation is common if intraocular pressure is elevated in the patients with Scleromalacia perforans.
thank you and thank you for watching.